Good morning for those of you in Europe and good afternoon for those in China. This is Giulia Zigiotti, Secretary General at the China-Italy Chamber of Commerce, one of the implementing partners of the EU SME Center. Today's topic is China Healthcare Reform, Features, Highlights, and Business Opportunity. EU SME Center is a project funded by the European Union assisting small-medium enterprises to do business in China by providing a comprehensive range of hands-on information, advices, trainings, and other supporting services. The center is implemented by a consortium of 6 partners, and China-Italy Chamber of Commerce is one of those. And today we are the organizer of the webinar. The webinar will last for 1 hour with a short Q&A session in the end. I would like to remind you that you can post question or send us comment during the webinar through the question pane on the left of your screen. Since the presentation is actually divided in 4 main parts and 1 case study at the end. If during the presentation your attention is drawn by one of the topics that are presented by our speaker, you can post directly your question on the pane and we will stop and keep 1 or 2 questions after the section that is of your interest. Additionally, we prepared poll question to better understand the population that is joining for the seminar today. And we will have a couple of poll questions along our webinar, and we invite you to join. In case your question will not be answered during today's webinar, I remember you that you can still register on the EU SME Center website and use Ask the Expert service to get your answer addressed. So I would like now to introduce you to our speaker today. Marco Gasparroni is Regional Head Greater China for Exprivia Group and CEO of Exprivia IT Solution Shanghai. He is also Vice Chairman of the China-Italy Chamber of Commerce and founder member and current Vice Chair of the Healthcare Working Group of the China-Italy Chamber of Commerce. I would like to hand over to Marco now and wish you a good time with our webinar today. Please ask as many questions you have and be focused on Marco's presentation. Marco, perhaps you could start with a brief introduction of yourself and of the healthcare of the working group, and I wish you as well to enjoy the webinar with us. Thank you.
Thank you, Giulia. Good afternoon or good morning, and depending on your time zone. I think Giulia made a very good presentation and introduction. About myself, I could tell that I arrived first time in China in 1999, and I was interested in healthcare since the first day I was here, because my first question is, what happened if something goes wrong here? So I visit an hospital already, not because in need, but just because of my curiosity. In the first week I was in China, and I was that impressed. My feeling was, better nothing wrong happened, actually. Since then, many things are changed, and I had the chance to be in touch with this business sector for many years. During 2003, 2007, I was directing one company doing teleconference, video conference devices, and we were providing video conference equipment for healthcare as well, also to the military for emergencies and risk. And Actually, it was quite easier than now to make business in healthcare. And now things are getting more interesting, more complicated. And that's the reason why I'm here to present you a bit more about how it is the situation with healthcare in China and how to build up business ideas or take business opportunities, making the business here. So everything was clear about how to use the webinar tools. This is the agenda. Of course, for those of you who doesn't know too much about China, we need a bit to understand the context. So we start with a few numbers, shaping the Chinese healthcare landscape today. Then we will go through the Chinese healthcare reform. We will discuss about the pillars of the healthcare system today and and the market opportunities for the USMEs and for the USMEs working here. Sorry. Then finally, the last point is to discuss about main challenges for European small medium enterprises operating here in China. So let's start. Many of you knows that China is the most populated country in the world, 1.35 million population. Many of you knows that it's the second economy in the world. Not many of you knows that 52% of population is already living in the cities. The spending in health compared to the overall GDP is not that developed today, despite the huge investment done in the last years in healthcare. So we have only 5.6% health spending compared to UK, which is 9.1, and Germany, 11.3. Maybe not many of you knows that already today, in the largest country in the world, by population, 8.7 is already older than 65 years old. This equal to 132 million of people, compared to 16 million in Germany and 14 million in UK. I think this can already address a bit your attention on what can be the challenges to do healthcare here in China, or to have a very efficient healthcare system here in China. Okay, let's take some shoots from some nut shoots, and let's try a bit to talk about the economy. Why am talking about economy in a seminar which is focusing on healthcare? Because mostly these numbers are really shaping what is happening now in healthcare. You see on the top left the trend of the gross domestic product since after the war, 1952, up to now. And you see that starting from 1980, when China experimented the open door policy, the economy grew up, and now is really touching the sky. That's why it's also the #2 economy in the world. China is not one homogeneous country, so on the right side, the corner, you can see how it is spread, this richness, and you see there are more developed areas and less developed areas. However, there is a very ambitious plan concerning urbanization. And this plan is foreseen to have 15 cities having more than 25 million people starting from 2025. This mega cities plan is taking place now and has many challenges, bringing many challenges, and healthcare is one of them. Left down corner is the breakdown of the China's primary energy consumption by energy type. You can see that 70% in 2011 was made of coal, which is clearly affecting the environment, and this is one of the reasons why the situation in China is not that clear right now. Only 77.3% was composed by renewable energies. China is making a very incredible plan to push the renewable energies, but the best they can do is by the 2020 is to have 20% of this renewable energy, which is impressive, but you may imagine that this will not change dramatically the environment and landscape. And this is exactly what happened by having a heavy coal composition of energy. I'm not sure how many of you are very familiar with PM 2.5 terminology, but this is microparticles that are affecting the environment, and is a kind of fog, is very highly polluted. And China is one of the most polluted countries in the world having this problem, and maybe the most famous, because other countries with this problem are not that famous for this as China. This of course have a heavy impact of population, and this will impact the future of healthcare here in China. Another strong trend is the demographic type. One-child policy has its own consequences. Although policies was recently relaxed, but the trend is a long-term trend. And you can see that in 2005, 34%, the bulk of the population was between 25 and 45 years old. Right now, not right now, in 2025, the forecast is just to have from 35%, from 35 years old to 65 years old. Most interesting, in 2005, only 7.5% of the population was over 65 years old, while in 2025, the projection is to have this number at almost 14%, almost double. Another important point to take in consideration, never assume there is just one China. China is very different across regions and across areas. Even something like the aging rate is different if you consider different regions. Here is an example that I got from, I think from the Economist Intelligence Unit. And you can see that there are areas, the darkest one, where the percentage of elderly population is higher. And there are many reasons for this. Just an example, in the top right corner, there is a forecast that by 2020 there will be a very higher rate of older people. And this is just because a low fertility rate in this area and a very low migration of young people there, because it's area which is not that developed. It's mostly big for energy industries and oil industry. If you see in the center, we have the same problem, but for opposite reason. The youngest generation goes away because they want to work in the big center, in the west coast, in the east, areas which are more developed, and that this migration flow leave the elder in that area. This is the reason why. But bottom line is by 2020, about 176 million of population will be older than 65. If you consider that the population of Germany today is about 80, that means the double of population of Germany will be over 65 in 4 years from now. You can imagine all the challenges linked to this. Another big and interesting phenomenon impacting China and its healthcare is urbanization. This phenomenon is strongly driven by the government for very good and ambitious reasons. These will very likely improve the living standards and conditions of many people. But more people living in cities will bring a higher income for them, higher disposable income. So these categories of urban residents, they will have more sophisticated and more interesting needs and demand in terms of healthcare. And this is something that we will see later, how this will impact in the demand for healthcare services.
Thank you, Marco, for this very comprehensive presentation about the background of China. So to summarize a few main takeaways of what you said, then China has a big population, an aging population with a higher disposable income, and it is more and more living in cities. Then let's move on with your presentation today and get a little bit into the healthcare reform. I just want to apologize for those that are following us online because we found out there are some delay in our presentation, so you might be not really up to date with Marco when he is speaking. So please be patient. It's just because the network may not be the best one. And I just remind you that the slides will be available in the following week. So the center will email you directly through the email address you used to sign up to today's webinar, and you will receive all the slides. I pass the microphone to Marco, and we start then the healthcare reform.
Here we are with the most challenging part of my presentation. I'm so glad that I expect to have many European attendees. They are not jet-lagged at this moment. We are doing this quite heavy topic. The need for a reform. China system had a very challenging situation in the past, and was not me discovered this in 1999 going to a hospital, but the problem was quite evident for everybody. Especially there was problem with large urban hospitals that used to have the main funding for markups on diagnostic and drug sales, and leading this as an incentive for doctors to overprescribe drugs, especially brand name drugs that are more expensive, because these will lead to more revenues for the hospital. But at the same time, the other problem was higher costs for the patients. We had to co-paid a part of the ticket while the Chinese government was covering most of it, but of course there was a problem there of systematic costs. Then the medical infrastructure varied tremendously among regions and capitals, spending lags other sectors. That means the quality of the healthcare was unbelievably high in the past among regions. Somehow you can say that your lucky health future depends not on your genetics number, but on your postal code number that is really impacting how likely you will be cured and healed. The insurance system was undeveloped, and as well as the risk management and risk pricing. The quality of medicine was also not very homogeneous, and there was also a large problem on counterfeits. And the high inefficiency cost was consequences of all this. If you can see this data till 2003, you can infer a few information about the patient refusing to visit hospitals and doctors because of the high costs. Still in 2003, in big cities, there was 64% of the people that was considering and was postponing to visit hospital because of the cost. This is for the inpatient, and for outpatient, still 30%. Of course, in the outpatient normally is more severe case. And you can see also how this percentage was varying across regions and small cities, rural cities, and etc. This is also an evidence of what I just said about the revenue structure per patient. You can see that till year 2000, almost 60% of the revenue per outpatient was generating by markups on medicine. So it was unbelievably high. This brings to a very comprehensive China's healthcare reform. The first sign was 2003. Few of you can remember the crisis of SARS, which highlight to everybody how unprepared was the healthcare system of China to face difficult situation and to impact on this. Based on this, a political bureau central committee start to plan to have a comprehensive healthcare reform in 2006. They also collect informations and suggestions worldwide on how to proceed, and then develop a very long reform that has made in 3 phases. The phase 1 was launched in 2009, and the second in 2012, and the third one will be launched this year and will last till 2020. In the first phase, the first target, it was to broaden the basic healthcare coverage. It was quite amazing, but not all the population was covered. Less than 80% of the population was covered by basic medical insurance, and so the people from rural or the people more disadvantaged was taken out from this situation. To improve this, the Chinese government made a huge investment, and you can imagine the cost behind this. The second was to establish a national essential drug list. That means a normalization of the medical drugs list and implementing a stricter price control over medicine. Another point was strong expansion of infrastructure for the grassroots medical networks in order to cover more second cities, third cities in China. One target is provide also equal access to basic public healthcare, and try to implement gradually a pilot reform with hospital, try to focus and to ban the excessive medicine sales. Why this was a pilot? Because of course, since this was the main source of revenues from hospitals, they could not cut the revenues of the hospitals from one day to another one. So it was a progressive process. Phase 2 is the one that is ending now, and was a very advanced way of reform. In this phase, the public insurance coverage reached 98% of urban and rural population, and with the fully cover of the basic health services for the elderly and the most vulnerable people. They also expand the list of essential drugs, and they strengthen also the information management services just to centralize the information of each patient using electronic medical records and smart cards. The investment in accessibility and construction of new hospitals for all the reform reached 40 billion renminbi, about 5 billion euros. You can imagine how big that was, this investment. But they also tried to act not only on the infrastructure things, but also on the soft skills like trainings and processes, especially targeting the improvement of professionalism of specialists and medical management in order to have a more efficient plans and process and reduce the costs of hospitals. The last phase, 2017-2020, will be actually a phase that is designed to cover all the shortcoming highlights during the phase 1 and the phase 2. In other words, everything was not working. They tried to cover in this period. There are a lot actually, and this is a shortcoming, but is also a very good opportunity to cover, because of course the reform was very complicated and complex. Among others, there is a new challenges on cost, sustainability and quality of services, especially in the remote and rural areas. They are not covered in the same quality terms that the big cities. So there is a huge need for cost optimization with new processes and new way to work. Just an example, long-term hospitalization is not very well planned in this moment. Diagnosis related to emergency is done always in big hospitals, in big cities. That means high cost of transportation, high cost of treatment of this patient in the big hospitals. And complex diagnostic is also complicated. Complex diagnostic is all the diagnostic requiring a second evaluation specialist. Then the aging of the Chinese population was not taken as a first priority in this moment, and this is quite clear from the difficulties that the elder has in get treatment, and also the lack of structure to treat in the best way elder people.
Thank you again, Marco. We would like now to open the poll. We would like actually to ask our participant if you are based in China and in which sector you operate. So we will give you a few time to vote, and then we will resume our conversation with Marco, moving on with the pillars of the healthcare system today. People are now actually joining our poll question. It's good, and try to do that as fast as you can, so that we can maybe share a few results with Marco in a while. And meanwhile, I'm just asking Marco a quick question. You just mentioned these different phases of reform in China. So based on the new 5-year plan that has been launched this year, are you sanguine towards this upcoming phase that is forecasted from 2017? I mean, is this healthcare sector benefiting from the new 5-year plan or no?
Yes, it is. Especially because the new 5-year plan is highlighting, is focusing on health, on innovation in every topic is treating. That means healthcare will be a subject of innovation as well, and actually there is a strong need for innovation in healthcare, and this innovation need is only partially covered by the Chinese companies right now. So there is a very large need of expertise and competences from abroad. So that's why I'm looking forward to the last phase, because now, how you will see later, there is a big struggling situation between the huge need of advanced technique and technology from abroad, and relatively closing attitude in terms of market entry that Chinese government and provincial government have in terms of foreign technologies or foreign companies. So I think I hope in the last phase of this reform, it will be quite clear what was worked and was a lot of the reform and what was not working, and maybe there will be a renewed push to open some part of the market for the most innovative companies from EU or from abroad.
Thank you very much, Marco. So just to share with you what were the results of the poll we just launched, amongst you, like 55% are actually already based in China, and 10% plan to enter the market soon. With a segmentation in different sectors, we have like half of participants that reply saying they are actually engaged in medical equipment, and half of them that are actually in pharmaceutical products. So I invite Marco to go on with the presentation, and I remind you that if you have a question that moves around the topic that he mentioned during his presentation, you can send to us the question so that we can reply at the end of the dedicated session.
Thank you. So I ask a bit of patience for the people that already attending from China, and maybe they know a lot of the information I'm sharing right now, but there is half of you that doesn't know too much about it, so we try to cover these topics. The pillars of a healthcare system today, there are many topics to cover, but I just choose two because this is what makes the difference now today in China. The one is the role of the hospital. The hospitals. The public hospitals is in China a multi-purpose center of the healthcare and is the gatekeeper to the healthcare system. Which means there is not a general practitioner here, there is not a family doctor, there are just a very large structure, huge structure if you compare to the average size of European hospitals, and this hospital try to cover every healthcare need of the Chinese patient. Can be emergency process, but it can be just a normal visit of the doctor. This is a huge difference compared to the European experience. There is not the general practitioners that knows you since you are a child and know your family. They just see you, most of them for the first time, and since few years ago they do not have even an electronic track record of what was your medical past informations. You can see that the structures in China since in November 2014 was about 25,000. Almost 2,000 is level 3 hospitals, which in China means the top level hospitals. The one who has the most comprehensive services and higher quality of healthcare coverage, and mostly they have on average, all of them have more than 500 beds, but you can easily find hospitals with 5,000 beds, even more. Level 2 hospitals are intermediate level with beds from 100 to 500, and they have the most important departments and diagnostic capabilities inside. Level 1 hospitals is a kind of territorial hospital, a local healthcare structure that is providing just a basic coverage. Still, the system of bringing everything to the hospital make the public hospital the first source of an efficiency of the process. Most of them lack of advanced processes. They do not have data interoperability and data sharing because, again, the patient was, since recently, was the main source of income. since from the selling of drugs or making medical things. So there was no intention of sharing the data of the patient with other hospitals, because if you're not happy about one and you want to change, then you need to do all the analysis again. This attitude was very negative, both for the patient but also for the Chinese healthcare system that in the past were facing to cover 2 or 3 times the cost for the same analysis, just to repeat the same analysis in different hospitals. So there is a big push from the central government to unify this data, to make interoperability communication between hospitals, but this is still a work in progress because the single hospital is still making a lot of resistance of this. So high cost and high healthcare service quality inconsistency coming from the hospitals. One new pillar that went in the picture since 2009 is the medical insurance. The healthcare insurance methodology was reformed and improved since 2009, and mostly today we have 3 kinds of public medical insurance. The first one is the urban employer basic medical insurance that is made by companies and is covering their employees and retirees with regular employee from all institutions. The enrollment is mandatory and is covering, as in for normal disease, outpatient is covering the 100% of the medical costs, while for inpatient and the severe disease they can cover between 80 and 95%, which means a very good coverage. The second one is the insurance for residents, urban residents, and this is covering on voluntary basis all the children and seniors, students and unemployed. That means everybody are out of the employment system, and even in this case the coverage is quite good in case of normal diseases, while the severe diseases is also covered in a quite a good way. The third one is the medical insurance for rural residents. It can be done on voluntary or mandatory way. Of course, mandatory is when somebody is employed and the coverage is not that far from the urban voluntary scheme. Now recently, since after 2009, there was the private medical insurance that are very strongly suggested, and this is something that is growing very fast and very quick, especially in the urban area, especially with the more affluent people. So now the 2 pillars is, from one side you have the hospitals, which are the gatekeeper of the whole healthcare world, and then you have the medical insurance, which are the way you are reimbursed. Why I spent so many words about this too? Because whatever you want to do in healthcare in China, you need to face the hospitals, of course, and the medical insurance. I just make a very simple example. If you have the most wonderful drug to be introduced in China and you approach the most important hospitals and you granted a wonderful market there, but if you are not in the list of the medical insurance, you are not, your drug is not reimbursed in the medical scheme, so it is very, very unlikely you have success in the Chinese market. So let's pass to the next topics, which is the market opportunities for small medium enterprises from European Union.
Thank you, Marco. I think now we are entering the most interesting part of our talk today. So I invite everybody to be focused. Marco will first mention which are opportunity for European small medium enterprises, and then move along those that are the main challenges. At the end of this, there will be also a case studies, and then we will open the Q&A session. Thank you.
Thank you, Julia. The healthcare market's perspective in China is the best ever. As mentioned before, the public spending in healthcare in China only 3 years ago was only 5.6% of the GDP, much lower than any level of a developed country. And China is still a country, not only the second economy in the world, but has a very huge perspective in GDP increase. Few fears the soft landing of the Chinese economy, but a 6% increase for the next 5 years is still a very interesting and stimulating data to make business here. So if this percentage of the GDP is going to expand, healthcare will be one of the most interesting focus for this expansion of GDP. In fact, many sources forecast a growth of the healthcare market expenditure in the next 5 years for about 21% per year. And they have a forecast, just an example, McKinsey is forecasting by 2020 one expenditure of 1.2 billion, which is actually the current GDP of Mexico. And that means by 2020, in 4 years from now, only the expenditure for healthcare market is this size. More opportunities will arise from the governmental support for private healthcare infrastructure development. They are really strongly believe that the introduction in the Chinese market of private, even foreign structure will improve a lot the efficiency model, and also the Chinese hospitals could improve their models based on this. There is also growing demand for Western medicine, as the middle class in the urban population is expanding. They have a higher expectation on quality of life. There is not a very good image of Chinese-made medicine, especially for specific topics like child medicine, etc. So the Western medicine is seen as a very good reference. Just an example, just to give you a visual example of this opportunity for growth. The pharma and medical technologies are expected to grow faster in China compared to the other major markets globally. On the left side, you can see all the technology in medtech. You see China is still not, the data is 2013, China is still not the very advanced market for this, but the annual compound growth rate from 2013 to 2020 is 14%, which is fast higher than any other developed economy, including US, Japan, and Germany, and also compared to the rest of other emerging markets, which include Russia, South Africa, Brazil, which are forecast only about 10%. This figure is more striking if you take in consideration the pharma market revenue. In 2013 was almost close to Japan, but again here the growth rate is 14%, which is far higher than the rest of the world. There is a very large space for healthcare, for elder care, and you can see, we saw before all the demographic trends that is bringing this to a very large population of elders. But today there is not a real residential care for elderly very well developed. Only 2% of seniors with more than 65 years old are in residence devoted to elderly. So there is a huge space of this. Most of them are covered and cured in the big hospitals. You can imagine the cost for the system and the inconvenience for the people that are there. In China, for culture, it's also not good to bring elder people to the hospital. So the integrate care and home care, whatever is possible, and smart health that is connecting the elder at home instead of making him or her moving and making big distance is a very interesting solution for the future. Rehabilitation centers are also not very developed, and because this lack of culture of residential care for elderly, trainings are very fundamental for the work, for the working of this model. So there is a lot of opportunities in each of these yellow squares. New demand from cities, the expansion of the middle class among the urban population is not only pushing the demand for elder, but also for the young. People with more affluent become more sophisticated in terms of demand in healthcare. Cosmetic surgery has already topped in APAC, is now the first market in APAC, Asia Pacific, and the third market in the world. And if you walk in the street of Shanghai and Beijing, you know exactly what I'm talking about. Private medical insurance products is becoming more important. People cannot rely only on public healthcare insurance if you are affluent. So you try to have this support that enable you to have the best healthcare system. To have the best healthcare system, the most affluent start to have medical tourism. That means to move in other countries to enjoy the better treatment, but also to enjoy the tourism there. So now UK, among the European countries, is a popular destination, but you can clearly see a very huge potential for Spain and also for Italy, especially if you match this medical tourism with this cosmetic surgery. Anti-pollution and cleaning technologies are really a big market already. I have myself a big consumer of this kind of products, air purifiers and masks and water purified. Functional food and pediatric food is also very important. It is a very top rising market here. The functional food is a food for people with specialized disease like diabetes, etc. And these come mostly from abroad because there is not that expertise now in China. Mobile health is something amazing in China because people are becoming more aware about their health, and in these huge cities, the relations among people are not the same we have in our cities in Europe, where you can ask your uncle or your mother-in-law if what is the best cure for some specific problem you have. They create a kind of network in which you can ask online doctor, and you can reach him with your applications, web form, and this doctor is also able not only to tell you what can be good in case of easy things, easy disease that you can predict over the phone, but also they will be able to raise up to issue some medical order to buy things in pharmacy. In all this, you understand that there is a very big momentum for healthcare IT. The Chinese government is committed to increase better functionality and efficiency of the system. So you really need innovation, you need really more integration of the system. The size of the market is expecting to grow very top level. The IT, healthcare IT in China is still at an early stage with investment specifically in the most easy products. The Chinese players are catching up quite quickly, but our interoperability system and what we have is still very interesting for them, especially solutions for the management of the regional healthcare. You can see here on the right, the top down corner, how the healthcare IT spending is still very little compared to mature economies like US, in which it reached almost the 5%, while in China was in 2009 almost 1%. Now the situation is higher than this. I don't have, unfortunately, more updated data, but the situation is not far from this. There is still a huge space for this. What are the main challenges for you SMEs approaching the Chinese market? Of course, the cake is very big and is very interesting, but that's not for everybody. So the regulations and the Chinese government are really a huge wall to enter this market. To overcome this wall, very often a reliable business partner is the way, and this is the way to also overcome the limitation in investment that very easily European small medium enterprises have approaching China. But don't forget that China requires resiliency and investment capabilities in any case. If you have a good business partner, please take care about your intellectual property rights. The preparation should be done before approaching the market, and here we have also the USME Center and the IPR Help Desk, which are institutions and desks made by the European Union in China to support you at the early stage of your work. Domestic players in China are very protected. They have the largest favor, they have the first right to enter to any market, any hospital, and it's difficult to overcome them, but this is possible. But in some cases, you cannot just enter as foreign companies, so this is also difficult. There is also very high cost, and so you should just consider China if you have a real market opportunity. So please assess this market opportunity before you enter the Chinese market. Again, the USME Center, your National Chamber of Commerce, or the advisors you can use are good channels to approach this. I make just an example of what I mean about barriers and the high cost in China. This is the CFDA, the China Food and Drug Administration approval and registration, which is required to commercialize drugs and medical devices and equipment in China. This is a big issue because in China the new therapies are not allowed to enter into the Chinese market because the standard in China is different and they're not consistent with those realized in all this kind of the world. So if you are registered in the best way in Europe and US, you need to start from the scratch here in China, or almost from the scratch. To make the things more difficult, since 2015, the registration process has become more complex, and the time needed for registration of new drugs are doubled. For companies with no direct presence in China, it's strongly recommended to use a Chinese agent or your Chinese lawyer, or sorry, your lawyer from you, which will coordinate a Chinese agent. As an example of costs, you can see the new drug registration takes now an average of 5 years, while in 2013 was only 2-3 years. And the application, just the direct external cost for this application could be very close to €1 million for one new drug registration, and about 200,000 euros for medical devices. If you can consider how much is the medical devices products, so you can see that China is not very cheap for this. But again, the European institutions, your national chambers, our working groups are very at your service just to support in this difficult task to enter in such interesting and compelling market.
Thank you, Marco. So if you are ready now, we would like just to pick up a few questions that arrived through our platform today, and we have still a few minutes. So if your question is not answered during the webinar, please feel free to use the Ask the Expert service of the USME Center after the registration. So going back to what has been said today, a few participants asked a question about air pollution. So does the healthcare reforms include specific solution to deal with illnesses that are related to the air pollution problem that China is facing now?
Yes, unfortunately not. The Chinese authorities are clear about the size of the problem. And they are clear that this problem will emerge in about 5 years from now in a very strong way. They try to tackle the situation with the origins of this problem. That means the industry that more causing this, and mostly is the pollution from siderurgical and metal industries and steel industries around big cities, which use coal for producing energies. From a healthcare side, they really try many things. They find a way to control a bit the weather, try to generate wind or rain whenever is really necessary. But still, there is not a clear answer to this problem. So there is the private citizen. They use air filters. They use proper masks that they can use. Not all the masks can use, but still, there is not a clear things. This is a drama for the Chinese population, will be a drama for the population, but maybe is also a good opportunity for all the European companies that can provide solutions, drugs, or technologies to cope with early diagnosis or treatment of cancer in the respiratory or the respiratory disease.
Thank you, Marco. Another question was about dental care. Do you see any opportunity for companies that do provide dental care services here in China?
Wonderful topic, wonderful opportunities. These I monitor monthly, this market by myself, going to the dentist. And I can see that the cost of a very good, no, not a very good, the cost of the same service in Europe is very, very high. So there is a big space of entering. I don't remember by heart, but I can send this data. The percentage of dentists per population is very low here in China. So, of course, if you are a multinational company, your target will mostly be foreigners live here that can afford a quite higher expenses for dental care. But still, the market is big because there are only few companies that can provide standard service. I mean, the same service we have here we can enjoy in Europe. So please welcome. I think this is a very good and promising sector, especially for chains of this.
Okay, Marco. Time is almost finished. So I would like to thank you on behalf of the EU SME Center and of the China-Italy Chamber of Commerce, together with other implementing partner of the center itself. A special thanks also to all participants that were with us today. We know that many questions have not been raised today, so will be followed up through the Ask the Expert function. In the end, I would like to remind you that our next webinar will be held on May 24th. The topic will be the 13th five-year plan. For the full calendar of events and publication from the Knowledge Center, we invite you to stay in tune on the EU SME Center website calendar. We look forward to seeing you again, and we thank you again for your participation to today's event.
Thank you.